Right.
My name is Tammy Rojas. I'm a co-chair of the Pennsylvania Poor People's Campaign, a national call for moral revival. A member of Poor People First PA, the National Union of the Homeless, and a minister with the Freedom Church of the Poor. I'm 46 years old. I was born and raised here in Lancaster County. I've worked low-wage jobs most of my life, have faced food insecurity, denied needed health care services, and have been homeless. There were many years where I was uninsured, and because of that, I didn't see a doctor regularly for needed care. Instead, I was one of many who only had the emergency room as an option. After finally getting Medicaid in 2014, I was able to finally start getting many of my health issues addressed. And although I still have a ways to go on that, I'm in a much better place with my health, having Medicaid, than I would be if I didn't. I'm currently working at a nonprofit that operates a night shelter, a food pantry, clothing bank, and day center. The demand for our services have grown significantly over the last year. My employer served 31,000 people in 2022, all together. And this year, we have already served 30,000 people as of last month. Governmental funds received are not meeting the demand. And so my employer has reached out to the community for help in order to meet the need. I took this job to learn from the perspective of a social worker who serves the poor. Many of us are poor ourselves, as well as having an opportunity to learn from our unhoused brothers and sisters and offer them to join us and become leaders in our movement to abolish poverty. We need to unite across all lines of division and faiths, because if we do not stand together and fight back, this crisis will just spin even more out of control. With recent money designated for addiction treatment going to the Drug Task Force and the building of a new, larger prison, it shows where our community's leaders' values are. We must stand up and speak out to make our politicians listen. No cuts to Medicaid and no more deaths in the streets.
Amen.
As a member of Put People First PA and the National Union of the Homeless, I was a part of taking on the fight against University of Pittsburgh Medical Center, UPMC, and power holders for the closure of St. Joseph Hospital, the conditions around Lancaster County Prison, and the attacks against the unhoused and criminalization of the poor. Throughout our fight around St. Joseph Hospital, we united with faith leaders from different houses of worship and brought them into the organizing work led by the poor and dispossessed. Because in this region, the distorted moral narrative of Christian nationalism is all around us, and those ideals are held by many of those in power. In fact, we are referred to as the Bible Belt of Pennsylvania. Local power holders have said to us that living in poverty is a choice we make ourselves. They deny their role in perpetrating policy violence. And how could we possibly take on UPMC? Because they are the Goliath of healthcare. But I look at who's gathered here, and I see many Davids among us who hold the power to unite and stand up and take down Goliath. Lancaster, we have it in us to unite across all lines of division and faith, even beyond what we already have the last few years. Our region of Pennsylvania has a strong history in uniting and fighting back against unjust laws, immoral policy attacks, while supporting one another as a community. We are standing here together and going to Harrisburg today to demand Governor Shapiro stop the Medicaid cuts, reinstate the adult dental benefit and Medicaid that was cut in 2011, and work with us to create an office of the public health care advocate. Now I'm going to lead us in a chant. I know some of y'all know it. Forward together.
Not one step back.
Forward together.
Not one step back.
Forward together.
Not one step back.